A very good evening to one and all. Thank you all for coming in today. Today we are here to have an introductory session on the Ritu Sameeksha, a new program by Pradipnya. We will be hearing from the teachers on which all topics they will be taking, etc. Let me give you a brief introduction of Pradipnya at first. So this is why we are here today. So this is a course, a 15-day online course on called Ritu Sameeksha, which will be a clinical exploration of gynecological disorders. The timing will be 7 to sorry. This is for this timing and all. I will let you know. And these are our teachers: Dr. Vijay Kumar, Dr. Wahida, Dr. Pradeep, Dr. Sitara Satishan, Dr. Amal Rose, Dr. Divya Srinath. So we'll be hearing from them on what all topics they'll be taking for us. And yeah, so actually we have started Pradiknya in November, and this was what you see on the screen. Cosmetology was one of the first courses that we started, and this is, I believe, the 8th course of Pradiknya that is about to happen. This was our second course, which is on Kerala Panchakarma, and this was our third course, Agni Karma course, and clinical utility of Uttaravasti Karma is another course that we had. Aromatherapy, that was a cosmetology itself, but another level of cosmetology. So this was another course that we conducted. We have had Vasti Karma, a course, and the teachers and everyone, you can see. This was a special course that we conducted called Ashana, which is a diagnostic steps that we need to take, and it was a 34-day course. This was one of our longest course. And this is Subalyam, which is currently going on pediatrics. And yeah, we have a course coming up on Rektamokshana. I will be one of the faculties, and Dr. Alex also will be one faculty. We'll let you know about all those later on. And these are the feedbacks from our participants after they have attended our programs. Thanks to all the encouragement, thanks to all the support, thanks to all of you for coming here with a positive mindset. And please, if you have any friends or family members in Ayurveda or colleagues who wants to learn about this, Prasuti and Sri Roga, this whatever the topics that we are having in this, you can please refer them to us. Again, few of the feedback from our participants. So this Ritu Sameeksha will be starting from the 23rd of this month, and we'll be ending by 5th of next month, April. And the timing will be 8 to 10. So we'll be opening the room at 7:30, and we'll be ending at 10 o'clock. 7:30 we open so that people will be able to come in without any hassle. And this is what we have. So we have kept the course fee for this as 2,499, and for students of UG we'll be giving it for 1,499. Okay, so we'll get into these details later on. So let us go and here actually talk to our teachers. I believe Dr. Divya is here now. Yes. So before I hand it over to Dr. Divya, let me give you a brief introduction of Dr. Divya. Dr. Divya, BMS, MS, Prasuti Antra and Sri Roga, PGDCR, BMS from Pankaja Kasturi College of Ayurveda, PG from Amrita School of Ayurveda, postgraduate diploma in clinical research and counseling and Ayurveda, psychotherapy, worked as a research fellow in infertility, a project on diminishing ovarian reserve funded by Department of Ayush Government of Kerala, conducted in the Department of Prasuti Antra and Sri Roga Government Ayurveda College Hospital for Women and Children, Pujapura, Trivandrum, Kerala. Specialist consultant in Sri Rudra Multi-Speciality Hospital and Research Center. Specialist consultant Dr. Divya's Ayurveda Gynecology and Fertility Specialty Clinic. Faculty, of course, of the course Diploma in Ayurveda at Del Rosario University, Colombia, South America. Awardee of Research Excellence Award 2020 and Woman Researcher Award 2020 by Sheen International Resia. Published scientific articles in several international and national journals, present papers in several international and national seminars. So let me hand it over to Dr. Divya to present her topics for this course. Over to Dr. Divya. Dr. Rahul? Is she here? Hello?
Yes, sir. Hello.
Is she here?
Yes, sir. I'm trying to connect with you.
Okay. Ladies and gentlemen, kindly be patient. So these are the teachers that we'll be taking the classes for us. We have Dr. N. Vijay Kumar, Professor HOD, Superintendent, Government Ayurveda College Hospital for Women and Children, Trivandrum, Kerala. Dr. Wahida Rahman, of course, one of the most famous over here, Senior Medical Officer, Government Ayurveda Dispensary, Pathanamthitta, Kerala. Dr. Pradeep Kumar, also a faculty who was there for our previous courses also, Research Officer, National Ayurveda Research Institute for Panchakarma, Cheruturthi, Trishur, Kerala. We had, of course, Dr. Sitara Satishan, also a previous faculty, and I'm very sure all the people are familiar with Assistant Professor, Department of Prasuti Tantra, PNNM Ayurveda Medical College, Cheruturthi, Kerala. Dr. Amal Rose KR, Assistant Professor, Department of Prasuti Tantra and Sri Rama, Vaidyarattam Ayurveda College, Ullur, Trishur, Kerala. And Dr. Divya Srinath, Specialist Consultant, as I told you, I just give you the introduction. So kindly be patient. Let me see if she is already here.
Hello, sir.
Yes.
She's in the name of Mahesh. I will unmute.
Okay. Okay. Oh, that is okay. Mahesh. Okay. Hello, Dr. Divya. Can you please unmute? Dr. Divya. I think she is having some trouble with her network. Kindly be patient, ladies and gentlemen. Hello, Dr. Divya.
Yes.
Yes.
Hello.
Yes,
Am
doctor.
I audible?
Yes,
Am
you are. Yeah. Yes, you are.
Okay.
Over to you, doctor. Thank you.
Okay. Thank you, Dr. Sham, for such a nice introduction. And good evening, doctors. First of all, I would like to thank Team Praditya, especially Dr. Sham, Dr. Rahul, Dr. Sitara Satishan, for giving me such a wonderful opportunity to be a part of this Sameeksha, and also along with some of the pioneers in this field who led a wonderful path for us to follow, who made Ayurveda gynecology and infertility more popular among common people. Nowadays, common people they opt Ayurvedic management for their gynecology related issues, and which is a good success for our path actually. If we are having a thorough knowledge in the subject, so that we can manage these conditions with utmost confidence. By attending this session, especially this 15 section, which will improve your confidence in practicing your gynecological issues. There are 15 sessions, out of which I'm dealing 3 subjects. One is endometriosis related issues, as we all know, which is one of the common topics that we get in our OPD. Almost 176 million women worldwide are suffering from endometriosis related issues like severe dysmenorrhea. I specify the term severe dysmenorrhea and dyspareunia, irregular bleeding, spotting related issues, which we can manage very simply with our OP-based management. And also certain issues like ovarian endometrioma. If ovarian endometrioma of size less than 5 centimeter, we can manage it out clinically without doing a laparoscopic surgery, which is commonly opted for endometrioma, especially ovarian endometrium or chocolate cyst, by allopathic management. Thereby we can prevent the complications of this cystectomy, ovarian endometrial cystectomy, like diminishing ovarian reserve. By this procedure, a good amount of ovarian follicles is lost by this procedure, which is one of an iatrogenic complications like diminishing ovarian reserve. There are so many reasons for diminishing ovarian reserve, which is also one topic that we are dealing in this session. Some of the patients which are coming to OPD with a bundle of reports showing that they are having low AMH and they are advised to do an IVF management, especially with their own egg or with a donor egg. Even with this such a type of IVF management, the success rate is only less than 11% only. Myself already worked as a research fellow on diminishing ovarian reserve project under the guidance of Vijay Kumar sir. There we got an opportunity to observe more patients with diminishing ovarian reserve, and with that project the success rate was almost 26% with a very little expense or little burden for the patient financially. And by this observing these almost 90 patients with this 3-4 years, by observing these much patients and we analyzing the case and also following so many research articles on that, we prepared a 2-hour session on this particular topic so that we can share with you doctors and you also can treat these conditions with utmost confidence. And the third topic which I'm dealing is with menopausal symptom. These which topic which we are given less importance in our clinical practice. Most of the women or lady which came to us with an age of more than 45-50 years, most of them complained of joint and muscular disease. We give less importance to their menopausal symptoms. Even they are also less aware of their symptoms. Most of the studies, especially studies done in Kerala, shows that the menopausal woman may have more psychological symptoms. That is, 80% of women were having psychological symptoms. There are mainly 3 studies conducted in Kerala. All these studies shows that most of 80% of women are having psychological symptoms, which we are less addressing the issues. Thereby, we can give more importance to their menopausal related symptoms, like some of the symptoms like somatovegetative symptoms, like hot flashes, palpitation, and urogenital symptoms like dry vagina, which affect their sexual life, and also some recurrent urinary infection, cystosis like that, which we are addressing the issues, and also encourage doctors to do a successful management on these issues. Along with this 15, after completing these 15 sessions, you may gain utmost confidence to manage these conditions. Thank you, and all the best, doctors.
Thank you, Dr. Divya. Wonderful, wonderful introduction. Thank you for that. So before I go on to the next teacher, let me just tell you that Dr. Rahul will be posting in the chat box the links to WhatsApp group that we'll be creating, so that we can post more details about this course, like the brochures and everything will be posted there, so that you can have an informed decision about this course. Yes, as you see in the chat box, you can see the link to the WhatsApp group. If you are interested, please do join that, and we will let you know all the other details about this course. So let me just move on to the next next speaker. We have Dr. Wahida Rahman. So let me give you a brief introduction of Dr. Wahida before I hand it over to her. Dr. Wahida is now working as Senior Medical Officer at Government Ayurveda Dispensary, Pathanamthitta. She had done her BMS from Government Ayurveda College, Tripunithura, batch with first rank, MS in Prasuti Sri Roga from Government Ayurveda Medical College, Trivandrum, 2005 batch. Working as ISM Medical Officer from 2006 onwards, successfully treated 1,757 infertility cases as on 7/3/2021. Awarded as Best Doctor of Pathanamthitta in 2015. Bishak Pradibha State Award of AMI in 2016. Charaka Award of State Government 2017. Conducted seminars all over Kerala, some parts of Tamil Nadu and Karnataka on various aspects of Ayurveda gynecology. Conducted webinars for doctors of Australia, UAE and India. She is a very famous doctor of our area also. So let me call upon Dr. Wahida. One second. Dr. Wahida.
Namaste, sir.
Namaste,
Hello.
madam. Over to you, madam. Over to you.
Okay. Thank you, sir, for the nice presentation or a nice introduction. Thank you, sir. Respected dignitaries and my dear friends, my humble pranamam to one and all. First of all, I would like to congratulate the organizers of Pradigna, the Ritu Sameeksha, for making this topic for the topic of interest as Prasudendra Stri Yoga, and it is for the propagation of Ayurveda and for making more confidence in practicing young doctors or the upcoming doctors. Thank you. And for the participants also, I would like to congratulate for participating this Pradigna online program. Then now, as the Dr. Sham said, I am working as senior medical officer in Government Ayurvedic Dispensary, Pathanamthitta, Kerala, in ISM department. From 2006 onwards, I am practicing as medical officer and also practicing in the field of gynecology and obstetrics or the Prasuti Stri Yoga in Ayurveda. By God's grace and the blessings of all my gurus, we have more cases in this field in Prasuti Stri Yoga and conducted more classes, and I expect this will be a good session to the upcoming doctors for empowering their practice also. And there are 3 topics for me. The first one is the Yoga Vichara, that include various yogas which can be used in both general cases and the Prasuti Stri Yoga. There are a lot of yogas and single drugs which can be used in wisely in the midst of our practice for the betterment of the society. And we will discuss in that class, that is the Yoga Vichara. And the second one is the antenatal care in Ayurveda, that is the Garbhini Paricharya. We would like we and all the practitioners would like to know the Ayurvedic management of Garbhini. As we are practicing in Ayurveda, there are lot of ladies or lot of families now and inquiring about the hope of Ayurveda and the quality of Ayurvedic antenatal care for producing a healthy, wealthy and wise baby, and from a healthy mother. So we are discussing in our antenatal care, that is the Garbhini Paricharya, about the Ayurvedic practices and more related to the practices, not with the theories also, more related with practices. Then as Ayurveda doctors, we would like to know about the Garbhini Paricharya in Ayurveda, and it will be discussed in that class. The third one is the common ailments in pregnancy and the Ayurvedic management for managing the complicated pregnancies, which deals the simple ailments with emesis gravidarum, hyperemesis gravidarum, and then the acidity, and then the diseases like Jora, Adisara, etc. Then there may be nowadays there may be a lot of IUGR cases. In spite of we are nourishing well, but there is a lot of IUGR cases, and also there is a lot of some difficulties in pregnancies like recurrent pregnancy loss, etc., which are caused by the antibodies present in our body, and the proper Ayurvedic management for rectifying that cases. And also there are a lot of Ayurvedic procedures and Shodhana therapies, and also the drugs which we can wisely use for the betterment of the society. And after that, the pregnancy related hypertension and pregnancy related diabetes mellitus, etc., we can make through through our practices. We can discuss that in the third class. And so the organizers arranged these 3 classes for me, and by the experience of these 15 years, some acquired knowledge, and with some knowledge with my gurus, etc., I will share for one and all to this platform for the betterment of Ayurveda society, as the propagation of Ayurveda is our mission, and practice with confidence is also a good thing. And now my prayers to all to the participants for Sreyo Bhuyat Sagala Janana. By God Almighty will help you all for practicing well and studying well, and love Ayurveda, learn Ayurveda, and live in Ayurveda. Thank you. Thank you very much.
Thank you, Dr. Wahida, for a wonderful introduction. Thank you for that. Let us now move on. As I told you before, Dr. Rahul is posting in the group, in the chat, link to the WhatsApp group where we will be posting all the details about this class, like how long will the recordings will be there, and everything will be posted in the chat in that WhatsApp group. So if you are interested, please do join that group. And any questions if you are having, you can put it in the chat, and I will try to answer them after this. So let us move on. Thank you, Dr. Wahida. Let us move on to Dr. Pradeep Kumar. So Dr. Pradeep was actually a faculty in our programs before also. So it is a proud moment for me to introduce him. Dr. P.P. Pradeep Kumar, Research Officer, NARIP, Cheruduruthi, Thrissur, BMS from Ayurveda College, Coimbatore, MS Prasuti and Sri Roga from Government Ayurveda Medical College, Ayurveda College, Trivandrum. Online certificate course in Health Research Fundamentals from ICMR, NIE, National Institute of Epidemiology. Formerly Assistant Professor, Department of Prasuti Tantra and Sri Roga, Ahilya Ayurveda Medical College, Palakkad, Kerala. Research Officer, Ayurveda at Central Ayurveda Research Institute for Hepatobiliary Disorders, CARI HD. Research specialization in Panchakarma in gynecology and Panchakarma in neuromuscular disorders. Principal investigator in retrospective pharmacoepidemiological study on safety and efficacy of Rasaushadis. Published 5 articles and participated in 12 national and international seminars. Resource person for many seminars, CMEs around the state and national. Let me call upon Dr. Pradeep now. Dr. Pradeep.
Yeah,
Over to you, sir. Yeah, over to you.
thank you, Shyam. Thank you, Shyam, for inviting me for this Ritu Sameeksha. And I have been talking to Rahul on this. And what I found very interesting in your program, the Pratigna organizers, which I will take few minutes to tell regarding your efforts in arranging a lot of valuable webinars in right this moment. And I'm really keen on your topics that you are focusing the topics which will help these budding doctors, and the relevance and the way you arrange the program is commendable, highly commendable. And after following it, my duty is here to address the students regarding the topics which I am supposed to take. The first topic which I am supposed to take is on dysfunctional uterine bleeding. The story started long back in 2012, where in my post-graduation, where my thesis was on dysfunctional uterine bleeding. And I gathered a lot of information regarding this dysfunctional uterine bleeding, and I have experimented a lot of treatment methodologies and medicines on them, and I have come into a consensus regarding its pathophysiology and its management. That is the knowledge which I gained from my as a student, as a researcher, and as a practitioner. And I found that the key point to address this dysfunctional uterine bleeding is a thorough understanding of neuroendocrinology, which most of our doctors lacks. This is the area, this is a gray area where we need to move on. We need to understand it a lot more clear, so that unless and until we are not able to understand this neuroendocrinology behind this female reproductive function, you may not be able to judge the symptom, or understand the prognosis, or understand the stage. Though the presentation of bleeding is similar in a lot of the cases, but you need to differentiate it. You need to differentiate its presentation. You need to differentiate regarding its onset. You need to differentiate with the associated symptoms. You need to differentiate with the duration of bleeding, pattern of bleeding. Lot of things are there to stay in dysfunctional uterine bleeding. What felt is, if you consider dysfunctional uterine bleeding is just as a bleeding, it's really impossible to manage it properly. There are a lot of sub-varieties in it, which is quite interesting. This lot of sub-varieties needs to be understood only by the symptoms. And what I would offer in this class is, I would make you understand each and every presentation of dysfunctional uterine bleeding with respect to Ayurvedic pathophysiology, and I'll make you help in diagnosing those pathophysiology and suitable management based on their state and stage of the disease. Though all the disease doesn't have a similar management, but all the disease needs and proper understanding based on its avastha, so as we can address the problem in a right way. And the prognosis of any illness depends upon the samprapti, right? So there are conditions which need to be referred. There are conditions which easily managed. There are conditions where we need to struggle. So these things, everything will be addressed included. And in the management, the medical management, the panchakarma management will be also dealt in elaborately. So that is regarding dysfunctional uterine bleeding. The second topic which I would be dealing is on uterine fibroid. As you know, you will get plenty of uterine fibroids without any symptoms. So you need to understand what is asymptomatic fibroid and how you address those things. There are a lot of symptomatic fibroids, and these symptomatic fibroids need to be subclassed. Though you understand its localization, the symptom presentations are different. So that prior knowledge is very essential, and you need to manage the symptom as well as the disease. So these things, these lakshanas and the vyadis, the samprapti, you need to differentiate in a different manner. You need to give medicine to reduce the fibroids. That is not the prime thing. You need to manage the associated symptom as well. So again, having said earlier that fibroid is a surgical case, but in surgical case, what is the Ayurvedic medical and panchakarma management? That will be dealt in my session, and I will help you understand very comprehensively the stage of the fibroids, right from its nidana, right from its samprapti, right from its locations. All those things, subtle things, will be dealt in my session, and that will help you. Only by understanding, only by knowledge, you will gain confidence. Only by knowledge you can gain confidence, and all these webinars are to enrich you in the knowledge sense, and thereby you will be confident when you prescribe. So that will be what you say, that will be ensured throughout my presentations. And the third thing is the gynecological panchakarma management in various gynecological disorders. So that is many gynecological disorders and even infertility, when and where which panchakarma is suitable and what is the scope of it. It's not like a single treatment is doing everything in any disease. So as treatment has its own significance, its own own therapeutic level. So that will be dealt in my panchakarma session. Like, for example, what is the role of permanent PCOD, when it is to be done and when it is not to be done. Like similarly, in most of the panchakarma management is related to all these gynecological diseases will also be dealt. So I hope my sessions will be enriching you in knowledge as well as in practical sense, and I am looking forward for it. Thank you all those doctors who are here today, and all my team of Pratigna. It's a wonderful team. The selection of team is so appropriate, starting with Dr. Vijay Kumar sir, who is my professor at the time. He is truly an he's like a medical college professor. It's not an Ayurveda college professor, and I respect him a lot. And although all the others, Dr. Wahida Rahman, Dr. Sitara, Dr. Amal Rose, and other Dr. Divya, I came to know regarding everyone. They're truly experienced and highly knowledgeable. So make use of it. Thank you. Thank you, Shyam.
Thank you, Dr. Pradeep. In fact, that is the one thing that we do properly. We try to, get good teachers for the programs. So that is our actually the name Pradigna is itself a promise. I used to say this before also. I've said this before also. It is a promise that we give to the participants that we will be getting you the best of the teachers from wherever of the subject that we are going to deal with. So again, before we move forward, let me just say once again, Dr. Rahul is posting a link to WhatsApp group in the chat. You can join that, and we'll be posting all the details about this program in that group, so that you can have a detailed knowledge about this before you decide to join. And Yes, there was a question about what was the course fees, and the course fees is 2,499 for practitioners, and for students 1,499. Okay, so this is for 15 days of class. So I'll give you all the brochures, all the details later on after presentation by the teachers. Okay, now let us move on to yet another teacher who has been a faculty in our programs before, Dr. Sitara Satishan. Dr. Sitara Satishan, Assistant Professor, Department of Prasuti Tantra and Sri Roga, PNM Ayurveda College and Consultant Physician at Kerala Ayurveda Nilayam, Kavalappara. Former Assistant Professor at Ashtanga Ayurveda College and Consultant Physician at various hospitals. She has an eminent academic track of being university topper in PG and college topper in UG examinations, and bagged prizes for paper presentation during academic years. Completed a UG from Vishnu Ayurveda College, PG from Amrita Vishwa Vidyapitham, PG Diploma in Yoga from Annamalai University, has published many articles, presented papers and posters in various national and international seminars. So let me once again call upon Dr. Sitara Satishan to introduce her topic. And as our teachers were saying, this is one of the rewarding practice or specialization you can follow, giving giving the smiles to the parents. It is godly, I would say. So over to you, Dr. Sitara, for introducing your topic.
Yes, hello, am I audible, sir?
Yes, you are. Over to you, madam.
Okay. Respected senior doctors, other faculties, other members of Team Pradipya and dear participants, a warm good evening, one and all. And as Pradeep doctor said, first of all, I would like to appreciate the effort of Team Pradipya for organizing a session on gynecology. Actually, you are doing a great job to all the young participants. And next, what I would like to say is that in gynecology, actually, we must understand that woman is the only key source for us to maintain this human race. So whenever we are treating a human or a gynecological issue, we should consider it at most importance. Okay, we should care her so much. We should care every woman too much when she is coming to our OPDs. So when you are treating a gynecological case, you should try to understand all the pathologies leading to that particular condition. You should always have an idea how to differentiate between the different conditions. You should have a clear idea about the investigations that you need to suggest to the patient. And coming to the prescription part, when you're giving a set of medicines, it is very clear that it is going to give some result. But when you are giving the exact medicine, understanding the correct pathology and the proper diagnosis, it is going to give the best result to the patient, and also that result will be a long-lasting result. So in this session, in this 15-day session, I hope you are going to cover almost 90% of the gynecological issues that you are going to see in your OPDs. And coming to my session, I'll be taking mainly 3 topics. My first topic is understanding and managing dysmenorrhea. And in that, I'll be dealing mainly with primary dysmenorrhea and secondary dysmenorrhea. I will help you in understanding how you can differentiate between primary dysmenorrhea and secondary dysmenorrhea. When you are having a doubt, what are the investigations that you have to suggest the patient to go and do in a clinic, in a lab? What are the investigations that they have to do, like the USG? At what time you have to suggest the patient to go for a USG? All that we will deal with. And also the management. What are the treatment modalities that you have to adopt when you're treating a case of primary dysmenorrhea? And what are the things that you have to do when you're treating a case of secondary dysmenorrhea? And my second topic is abnormal vaginal discharge. And in that, in our OPDs, you usually get many cases of abnormal vaginal discharge. In that, the first thing is, first you have to demarcate between whether it is a physiological discharge or whether it is a pathological discharge. And in that pathological discharge itself, in terms of doshas, you have to identify whether it is due to a pitta related condition, whether it is due to a kapha related condition, or whether there is some combinations is leading to this condition, and also whether the patient is having some other systemic disease that is leading to this condition. You need to identify all this. Based on all this only, you have to suggest a medicine to a patient. So in that session, we'll be dealing with all that things, and also the treatment aspects. What are the treatment that you have to adopt when it is related to some kapha related condition, whether it is due to pitta related condition? What are the differences that you have to practice when you are treating such cases? And my last topic, that is the most important area of the gynecological practice, that is the Sthanika Chikitsa, the local therapies that you can give to a patient. And one important thing is that these local therapies, the Sthanika Chikitsa, is very easy for any person to practice in your OPD when you have a minimum set of instruments which you can practice in a sterile condition. It is very easy for you to practice. So in that session, we will deal with most of the Sthanika Chikitsa, the local therapies that you can do in the gynecological cases, like the Yoni Piju, the Yoni Purana, the Basti, all sort of treatments we will discuss in that session. And also I will just give you a guidance in which all conditions you have to select these therapies, like Yoni Basti in which condition, Yoni Piju in which condition, how you can prepare a Yoni Piju, what are the preparatory procedures that you have to tell the patients before doing the Yoni Piju, after the Yoni Piju, what all things they have to do. So like all that sort of things we will discuss in the third session, that is the Sthanika Chikitsa related session. So I'll be dealing with these three topics, and I hope all these sessions are going to give you the best. So just utilize these sessions, gain confidence in you, and try to be the best practitioners of gynecology after attending our sessions. And I wish you all the best. Thank you.
Hello. Yes. Thank you, Dr. Sitara, for that introduction. Thank you for that. And as you said, you are right in saying, this is need to be done by the participants. So that is our ultimate aim. So we'll be having a WhatsApp group of the participants with the teachers, when you join this course, and this WhatsApp group we will try to keep this for as long as possible, so that you can have a interaction with the teachers, and whenever the teachers are free, they can answer some of the doubts that you will be having. So it'll be like a hand holding for you to practice this. So that is what our ultimate aim is, that you start practicing what you are, what you study in our course. Now we are in the midst of a legend, actually. So let me now introduce Professor Dr. N. Vijay Kumar. Dr. Vijay Kumar, Professor, HOD and Superintendent, Government Ayurvedic College Hospital for Women and Children, Trivandrum, Kerala, graduation and post-graduation from University of Kerala, with 35 years of clinical experience and 28 years of teaching experience. Currently PG Board of Studies member, University of Kerala, well known in the field of infertility management, resource person and moderator for many national and state level seminars, workshops, CMEs, ROTPs, and speaker in various medias, presented several papers at national and state level seminars, and published several scientific articles. So let us hope we can learn a lot from his experience. So let me hand it over to Dr. Vijay Kumar for his introduction. Sir.
Hello.
Sir. Yes, sir.
Yes.
Yes, sir.
Good evening, one and all. Some problems arise here. Okay. First of all, I would like to express my sincere thanks to the committee or the all partners for inviting me to join as part. Ritu Sameeksha, clinical exploration of gynecological disorders. Very good topic. In this session, my role is to answer the questions regarding various gynecological conditions from delegates at the end of the total presentations. At the end of the total presentations, I will get 2 hours to answer the questions from the presented papers or outside the papers. In addition, if I joined on session, at the end of that particular session, anybody can ask questions to me also, but the presenter or the resource person is the responsible person to answer first regarding his paper. Today, we have to discuss about the aim of section. You see, either primary aim or secondary aims. First of all, I have to say that to update our medical knowledge in a holistic way. That is, so you should follow a hard-working student's life, especially with the Kagadrishti and Shwana Nidra, keen observation and ready to answer or ready to observe things. To bring, you see, it is an essential area to bring evidence-based explanations for the questions how or why. Then healthy and logical interaction will definitely enhance our medical knowledge both theoretically and practically. in the present era, you see, irrespective of the medical system, whether Ayurveda or allopathy or homeo, the clinical practice is a challenge because, people or patients are very conscious. They will get medical knowledge in the fingertip. So we are responsible to explain each and every micro points regarding their conditions or diseases. Then you see, what are the investigations to be done and what is its essentiality? Investigations should be logical, cost effective, or avoid unnecessary investigations. You should bring a nutshell idea regarding the proposed treatment modality and also the prognosis or the forecast or the predict or the probable outcome of the disease. You see, I personally I am getting almost all types of gynecological cases like DUB, endometriosis, adenomyosis, PID, small fibroids, antenatal cases, postnatal cases, etc. But I am focusing in the field of infertility management. I am getting number of referral cases from various allopathic gynecologists. You see, treating of infertility is not so simple because they demand a new life creation or a child. Infertility, you see, infertility couples are always in stress and strain. Many of the couples are wandering from one center to other or one doctor to other. So when an infertile couple come to your center, since the beginning, that is from the reception onwards, to be treated nicely. At least use kind words and given them adequate time to explain their history or what are the things done before entering to you. You see, most of the patients come to us with a bundle of files with them, but it is very difficult to go through all the files, especially the doctor. Usually the doctors are always busy in the OPD. Anyway, you should make a habit to note down the important points in your own file. Someone will say that actually we have no hope, but someone has recommended your name, then our responsibility will become high. All the cases are not alike. Anyway, try to minimize investigations by thorough clinical examination history or previous investigation reports with them. You see, here very expert resource persons are included in this session. Almost all are my bright students. Dr. Pradeep, Dr. Wahida, Dr. Amalrose, Dr. Divya, Dr. Sitara, etc. Hope that they will contribute so many things for you. I am again repeating my message in the Ayush Ayurveda, in the International Ayurveda Day. Ours is a beautiful science. Keep it in the kind. My good wishes to the delegates, resource persons, and reception committee. All the success for the coming 15 days program. Thank you.
Thank you, sir. Thank you. Thank you for that wonderful introduction. Thank you for that. Ladies and gentlemen, we have one more teacher to go. So before I, go to her, let me just tell you once again. We will be posting this video. If you have come in late, do not worry. We will be posting the same video in the, in the group that Dr. Rahul is posting in the chat. There's a link to the WhatsApp group. You can click on that, and all the brochures, everything, every detail about this course will be posted there, as well as this video will also be posted, and you can see this video tomorrow so that you will get a complete picture if you have missed one or two portions. Now let us go to, before after giving this after we hear from Dr. Amal Rose, I will give you a basic idea about this course if you have come in late. Okay, so we have next Dr. Amal Rose KR, Assistant Professor, Department of Prasuti Tantra, Vaidyaratnam Ayurveda College, Ullur, Thrissur. BMS from Wahida Rahman Ayurveda College, Ullur, PG from Government Ayurveda College, Trivandrum, University second rank holder in final year MS examination in 2016, worked as assistant professor, Department of Prasuti Tantra, PNNM Ayurveda Medical College, Cheruturthi from 2017 for 2.5 years. Presently working as assistant professor at Wahida Rahman Ayurveda College since 2019. Has presented papers in various seminars and has published various peer-reviewed journals. So let me call upon Dr. Amal Rose. Dr. Amal? Hello?
Yeah, good evening, sir.
Good evening, madam. Over to you.
Okay. Respected teachers, my seniors, my colleagues, and the organizers of Team Pradigna, and all the budding Ayurveda practitioners who are very keen to, learn more about Ayurveda and especially Prasuti Tantra. I welcome you all. A very good evening to all of you. So, as far as Team Pradigna is concerned, I've gone through what the works they have done before. So the subjects they are dealing with, basically the Kaumara Pratya, Prasuti Tantra, all those topics are really relevant, and each Ayurveda practitioner must know the correct facts to address the current issues, because so many people, especially the people of Kerala, they are, I think through my practice, what I want to tell is that they are mostly more reluctant to come to Ayurveda as a first option. But why Prasuti Tantra? As far as what is the importance of Ayurvedic Prasuti Tantra, I will just explain. So when I was doing my house surgency in 2011, when I was sitting in my OPs in Prasuti Tantra OP, I was watching so many patients who come to an Ayurvedic gynecologist only after, mostly, not all of them, but mostly they go to allopathic physician first, and then they come to an Ayurvedic gynecologist. But the situation has totally changed now, and there are more and more people who come to an Ayurvedic gynecologist as a first option. So why they have chosen so? Because it is very clear that Ayurveda has a very much deep-rooted science. It is a very deep-rooted science, and there are so many medical options, especially without any hormonal impacts. So basically, it is very much important to learn Ayurvedic Prasuti Tantra and so many practical diseases, that is like the DUB, fibroid, endometriosis, infertility, and all our specialties, especially the antenatal care, and also the role of Panchakarma. Everything is dealt in detail in this sessions. So now coming to my topic is polycystic ovarian syndrome, that is PCOS. It is I think it is a pandemic when gynecology, the subject gynecology is concerned. Why so? So basically, I will be taking two sessions. One to explain the modern aspects of polycystic ovarian syndrome and the Ayurvedic clinical concept of PCOS in Ayurveda. That are the two sessions. So why PCOS is important, or why should you learn more about polycystic ovarian syndrome? So the current data tell that in India, 1 in 10 women is affected by PCOS. So why the incidence is increasing? Have you ever heard of PCOS with a large amount of incidence in, I think back 5 or 10 years back? No, it was not so. So it is basically important that it is a lifestyle disorder. So in the COVID pandemic issue, when we go through the OPs, the incidence is always increasing. Why? Because in that this lockdown period and all those stress factor has added a lot to the incidence of menstrual irregularities in women, in all age groups, I should say. So then what are the causes of PCOS? So the starting from the hereditary factors to the chromosomal factors and to the stress factor. So basically you should learn to treat PCOS according to the patient, according to the history told by patient. We should consider the nidanas of the patient, and it is actually the treatment of PCOS is different from patient to patient. So we can't learn that this is the treatment of PCOS. So we should learn more and more deep into it. And also, what are the diagnostic criteria for PCOS? Basically, we go for a USG and tell, okay, the impression is written polycystic ovarian syndrome. Whether that is enough, no, we should look into detail so many points in an ultrasound scan. Then only we can know about the gravity of the disease. And what about the patient presentation? There is a starting from 12-year-old child, you can get a lady up to 40, 45 years presenting with menstrual irregularities. Why so? So all these treatment modalities are different in all those cases. Now, some patients may come to us with the family is completed, they have 2 kids, and they are not even bothered that they are having menstrual irregularities. They come to us and present with, like, we are having weight gain, we are having all those pimples over our face. Even they are unaware of the fact that they are affected with PCOS. So I would also urge you all to spread awareness to understand or diagnose PCOS at a very early stage and treat it effectively. Why so? Because it is having long-term sequelae like carcinoma of endometrium, diabetes mellitus, and so on. So I'll be dealing all those things in detail, and also the Ayurvedic concepts of PCOS. And also one more thing is very much important while treating PCOS. Whether the treatment is given and it is okay that they get regular menstrual cycles, is that okay? But there is more and more recurrence chance of PCOS. Why so? Because we have to stress upon the pathyas. Pathyas are very important in the case of treatment of PCOS. So I'll be dealing all these themes under the section, 2 classes, and the faculties are also a very good selection. I would appreciate the organizers of Team Pradigna, Dr. Shyam sir and Dr. Rahul, for selecting such a wonderful team, starting from Dr. Vijay Kumar sir, motivator and a teacher. I don't know how to explain him, sir. We are all huge fans of Vijay Kumar sir, and my seniors, Wahida madam and Pradeep sir, who have motivated us so much to love Prasuti Tantra and love Ayurveda, and other faculties, Dr. Sitara, Dr. Divya, etc. So why you should come to learn Prasuti Tantra is that Prasuti Tantra is a means the treatment told in Prasuti Tantra is very much essential to deal all the diseases, basically dealing with females, starting from a 10-year-old child to a 50-year-old lady, and even the postmenopausal aspects, you should learn it correctly. And especially the female practitioners, you will get a bundle of patients, starting with all these widespread diseases which are mentioned in our sections. So love Ayurveda, learn it thoroughly, and be confident in treating all these diseases after you attend the session. All my very best to all the practitioners who are and students who are going to attend the session. Thank you all.
Thank you, Dr. Amal. Thank you for that introduction. And you are exactly right. People go for modern treatments first of all, and then spend a lot of lakhs of money actually, and then come to Ayurveda. And nowadays the trend is changing. They are, they have understood the importance of Prasuti Tantra. Thank you for that, reminding us that. Thank you for that. And now let us move on. So let me just show you. These of course these are the teachers that we just heard from, and we'll be posting all the details in the WhatsApp group after this. If you have come in late, you can join that WhatsApp group that Dr. Rahul is posting the link to in the chat box, so you can click on that and join that WhatsApp group. All the details, all the brochures, even this video, if you have come in late, if you want to see or listen to the teacher once again, you will be able to do that from the group. So let me just give you a few details about the course so that you'll have a better knowledge about the course. So we have, these are the topics that will be covered, and there was a question in the chat if only Ayurvedic perspective will be there or modern also will be dealt with. So we have a balance, because 15 days is not enough to complete Prasuti Tantra and Sri Yoga. It is a 3-year course, right? PG. So what we have done is we have taken the most common cases that we come to our OPD, because that is where we have to excel. That is where Ayurveda should excel, because that is what gives belief to the patients later on. So that is what our motive is. So all these topics, all these course details will be posted in the chat and in that group, WhatsApp group, and you can choose from there. Or if you want to have if you have any more doubts, you can contact the admins also in that group, and we will give you a complete picture. So this is our website, www.pradiknya.com, and you can reach us at pradiknya@gmail.com. Just take a screenshot of this page, so that if you have any doubts, you can contact these admins. We have Dr. Anjana Unnikishan his number, and Dr. Rahul's number. Again, as I told, all the brochures will have this number. So let me give you the basic idea about this course. This course is for 15 days. If you have come in late, I've already explained this in the beginning. So 15 days course. It is called Ritu Sameeksha and gynecological exploration of clinical exploration of gynecological disorders. The course will be for 15 days and 30 hours total, so 2 hours per day. We have 6 faculties, and all the details are there already. The course fee, somebody was asking, it is 2,499 for practitioners, and for students of UG, we have kept it as 1,499. And we are starting this course on 23rd of this month, and it will be over on 5th of April. And the timing will be 8 p.m. to 10 p.m. We have kept this time also so that the teachers will not be affected because of the class, because they are voracious practitioners, and we don't want to any patient to wait on them. And this also helps the participants to come in at a little bit late, even after their office or after their class, they can come in and learn. So that is why we have kept that time. So I hope I have answered everything. Yes, all the topics will be included. Yes, again, we'll be posting all the brochure, all the curriculum, everything will be posted in that group. So you can just click on the link and join. I think I have answered all the questions. So let me finish off today. So just want to give you one message before you go. Yesterday is not ours to recover, but tomorrow is ours to win or lose. So just want to introduce our team. Dr. Anjana Unnikishan, Dr. Rahul J, and myself are the partners of Pradiknya. And as we say, keep learning and keep growing. Thank you all. Thank you all for coming. Thank you.